Hey guys, welcome to Tuesday. This is stop number 15. We're at Flemington Chiropractic Center, and we are with Lindsay Mansueto.
That's it.
All right, I said it right.
How are you?
Dr. Lindsay, yes.
Yes.
Yeah, what do your patients call you? They call you
Dr. Lindsay.
Dr. Lindsay? Okay,
Yeah.
that's what I thought, but I didn't want to assume. And then,
No, I like that.
most people would stop and ask that first, but not Carolyn. So, all right.
Dr. Lindsay.
But, of course, Jenna's here. Yes, Dr. Lindsay. All right, so.
Hi, everybody. Welcome to our practice. We love practicing here in Flemington. The people of Flemington really do get it. They are health conscious. They want to make sure that they're eating the right foods and that they're moving their bodies well. And I've been nothing but happy since we've opened this location 4 years ago. So it's really been going quick and really proliferating really super fast. And I have everybody in Hunterdon County to thank for that.
Nice.
Hunterdon County is the healthiest county
Of all New Jersey.
That's
Right,
cool.
right.
I'm always trying to find more people, admins and chiropractors included. I'm like, don't you want to work in the healthiest place in New Jersey?
Yeah.
And it's beautiful out here.
Yeah.
So,
It is.
I would love to talk about how chiropractic care can really help people who are experiencing chronic pain. If you're in chronic pain, if you're reaching for an Advil or a Tylenol or a Motrin bottle and trying to make yourself feel better using pills, that's how you know that you have pain that you need some help with. So hopefully you would try chiropractic care because it is an alternative to standard pain management, which would be more of an anti-inflammatory pill, an injection, or a surgery. And chiropractic care is really not invasive. We have really low malpractice insurance because we don't harm people. Some people do get nervous when they go to the chiropractor because they do crack and click, and those are just gas. So I always say it's okay if you get nervous when I adjust you, but the next time you toot, you have to be like, oh my God, what is that? Because it's just gas. So we adjust people from as little as 5 days old to 105 years old. There are different techniques for different bones and different brittleness. So if you're a geriatric patient, we might not be doing the same technique as somebody who's a bodybuilder. Sure. So each treatment plan is tailored to that person. And we love providing people with an alternative because I know I was a junior in college and never had been adjusted. And I hurt my back and I was pre-med. I wanted to be a medical doctor. And I went into a chiropractor at a 7 out of 10 on the pain scale. And the same day I left at a 3 out of 10. And I was like, this is for me. It was quick.
That's a cool
I had
story.
a really great, response. And I didn't have to cut anybody open or surgically put them back together. And immediately fell in love with chiropractic care. So if you guys have had pain and you have an issue with finding some relief, I would highly recommend any kind of physical medicine modality in contradiction to a pill form. So whether it's chiro, PT, acupuncture, just simple exercise, it all helps the body move in coordination with each other.
That's great advice.
Yeah,
Really is.
and Hunterdon County definitely does have an opiate issue. So people will come in for just a pain, and if your medical doctor, if you're in pain, and your medical doctor's first thing is, we'll take this opioid narcotic, that might not be the right doctor for you. You might want to try some things. You might want to just ask them, are there any other, that's how I found chiropractic care. I hurt my back. They wanted to give me pills. I had a bad experience with my wisdom teeth. So I said, no, that's not going to work. And that's how I found chiropractic care. So it could be a life changer. And it's definitely non-invasive, and there are low-force techniques. If you really don't like the clicking or the cracking, if you're the kind of person that gets grossed out by your knuckles making noise, then you might want a low-force adjustment. And there's plenty of chiropractors around Hunterdon County that can help you do that.
Definitely.
Yeah.
Very cool.
That's awesome.
Yeah.
All right, so what else are we going to do today? We kind of talked about some guinea pig stuff.
Real quick around your office.
Yeah, sure. So this is where we do our exams. So my reflex hammers are going, and people are doing range of motion, kind of figuring out what is the problem. And then once we ascertain the actual diagnosis and what's going on, we take them back to a treatment room. So why don't we go that way?
Okay.
Can people come for preventative care as
Absolutely. People who are feeling okay and don't have any aches or pains, but want to make sure that they are at what we call peak performance, they might come in just for wellness visits.
Nice.
So coming back here, this is our family treatment room. We've got, this is Stripes the zebra. He likes to say
love
hi.
it.
And we do treat kids here, so we do have a bear.
Okay.
To make them feel better. This bear says Flemington Chiropractic Kits.
Nice.
And when you give this bear an adjustment,
Oh, I love that.
The kids get to play with this bear as they stretch them out and get them ready for their adjustment.
That's awesome.
So a typical
it.
standard adjustment, I would start by stretching out a patient.
Okay.
And if you want to be my guinea pig, I don't know if you could do that while doing Instagram, where she could.
I can.
She has 2 hands.
Okay.
Should I take my sweatshirt off?
You can.
All right.
And you're gonna lay face up with your head there and your feet down here on your back.
On my back.
Mhm.
On my back.
Yeah.
I can follow directions.
Sorta.
All right. So usually we want to prep the muscles. So we want to make sure that we're stretching the area. If there's any pain or any kind of discomfort with this, just let me know.
Okay.
So we just want to open up the disc space. We want to open up. People think these are leg stretches, but it's actually a lower back stretch. Bringing your knee into your chest is a very good thing to, if you're having back pain, to relieve it. And you can do this at home. You don't need to have a doctorate to know how to bring your knee into your chest. You hold it there for 20 to 30 seconds, and then you can move on. That knee was a little
I
tight.
felt that.
Yeah.
Guys, I've never gotten a chiropractic adjustment before.
So this is the first one. First time for everything. So first time on camera. Now I'm going to do a glute opener. We're going to stretch out your glutes. So I always say sitting pretty like a lady, bringing the knee up to the face, then over the body. You should only feel those in your gluteus medius, but not in your lower back. All right, good. So we're going to hold that there. And then same thing, other side, just opening that up. Very good. And these allow the pelvis to operate more normally. If the glutes are really tight and there's a lot of tension, it makes our lower back compensate. And that's when we start to get degeneration in our lumbar spine. So I always tell people, stretch as a family. Don't let the kids think it's only something that older people have to do. Kids can start young and learn to stretch. And I have an almost 2-year-old who, if I ask him to get into downward dog,